a very daunting task, but certainly something that we embrace. I was out yesterday. We were talking earlier with Executive Budish that we were out yesterday for 13 hours working at the fairgrounds to vaccinate folks, and we vaccinated almost 1,600 people in just the last 2 days, and over that time. And it's great to see the vaccine being distributed. It motivates you knowing that that is our pathway through this pandemic. So with that, I'd like Jonathan to, if we could, to switch over to our data brief as we move forward and close out here on our updates. So you folks are familiar with our brief, and so if we look at the data here in our case overview, looking last week, we had over 50,000 cases and 3,130 hospitalizations, and of those 650 ICU admissions. And so certainly Dr. Hall can relate to these numbers and understand them. He is a living, breathing epitomization of the impact of this virus on our community. And sadly, we've had 1,180 fatalities. And a bright spot, of course, is closing in on 43,000 people have recovered. So we're glad to see that. So what we've really been talking about is this combination of offense and defense in the community. The defense is our work around case investigation, contact tracing, cluster investigation, even as we move to offense to deliver vaccines. So this is the world that we're living here in public health, and it'll be that way for quite some time. We're not out of the woods yet. If we look at our weekly trends, our case report numbers are down right now from the previous report. We also know the holidays have had some impact overall on our case numbers. As you'll see in a little bit, the number of folks tested has dropped, and we think that ties both to folks now thinking about vaccination, but then also the holidays have probably deterred a bit some of the testing that was happening previous. But folks will see as we go forward that COVID-19 is very much still a big problem in our community and is surging. And we've seen an increase in deaths over the previous week reported. We are still red, or the level described in the public health advisory system. We are still on the red level here in Cuyahoga. So if we look at our demographics as we move down, Jonathan, around the page, you'll see that 45% male and 55% female. And the age groups have been fairly constant. In the bar graphs there, you'll see that our largest group continues to be 20 through 29 years old, and many of them also are, because of the way they move around the community, can be drivers of cases. At the very end of the graph, you'll see that we have most of our fatalities are occurring in that 70 plus age group, and certainly that justifies really, if we go forward from 65 forward, why we're focusing on that age group as we begin to prioritize into 1B. We see our race data where 56% of the cases are white, 23% black. We have 13% of folks where we don't have that data. We did not receive that. There is a 2% Asian and 7% would incorporate other Hispanic, Latino, and other races. You'll see that 9% of healthcare workers account for the cases. To date, that number has dropped over time. I think the hospitals certainly have done all they can to prevent exposures in that environment. We have our race and ethnicity data in that bottom graph, where we have about 71% non-Hispanic Latino and about 3% Hispanic Latino, and about 26% of people have pre-existing conditions. If we look at the race data, we'll see that African Americans are about 1.4 times more likely to be a case of COVID to be diagnosed, over 2.7 times more likely to be hospitalized, and more likely to die. And so certainly these inequities perpetuate and have been known for many decades in diabetes, late stage cancer diagnosis leading to higher rates of fatalities, asthma, heart disease, a whole range of chronic diseases. And so this is yet another example of racial inequities and health that we're demonstrated in our society and need to be addressed. If we move down and go to our epi curve, you're familiar with this. These are red bar graphs by day, starting from way back at the beginning of the pandemic on the left going forward, and you'll see this huge surge that we're still amid in Cuyahoga County, those red bars, and we watch those very closely. We have seen a bit of a drop, but some of that relates back to the holidays, and we need to see what happens next in the coming days and weeks. But we really believe through March, we have to maintain that vigilance going forward. If we move down, you'll see the zip code map, and these have been fairly stable across. This is a map we put together with the Cleveland Department of Public Health, and these numbers have been fairly stable in terms of distribution for many weeks. So we'll move to the last page, and these are the numbers we watch closely and why the hospital vaccination campaign makes sense to be first. You'll see here with the gray line, our critical care beds, our ICU beds are at about 80%, and our adult medical beds are at 79%. That has fluctuated, but we are still up from where we were, way back in March. And we watch those numbers because we don't want to be stressing the system. And certainly healthcare workers getting sick with COVID, it can affect the ability to staff all these beds that are available. We've seen a slight drop in ventilator utilization, that yellow line, but an increase pediatric medical beds that have occurred, but they're both at 45%. What we're seeing next are some very, very concerning data around our testing for COVID. And so as we move down the page, you'll see here the next two pieces of information relate to hospital testing and nursing home testing. And so if you look at the bottom, you'll see over the last week of data we received, overall the number of tests in hospital systems has dropped by about almost 15,000, or a bit more than 15,000 since the beginning of December. And our positivity rate is at 24.2%. We're approaching 1 in 4 people tested are positive. So we need to understand what that means. Just because we saw a drop in testing, that could mean also there's lots of people out there that haven't got tested, that maybe think vaccinations are here and they don't need to be tested. What they need to understand is this risk is very real, and they need to protect themselves and others around them, and remember that vigilance, hanging on here for just a few more months until the spring, is essential, because we want to limit the heartbreak experienced already by this pandemic, because it's still very much a big threat in our community. Lastly, this number around nursing homes, which is why that is a concentration for vaccination, is almost still at 18% of those tested. So very, very high numbers. And so we're concerned about making sure we play offense and defense here in the coming days and months. We're excited about the vaccine rollout and hope that those number of doses increase. Glad we have more partners joining us to distribute vaccine in the community. And so things are looking up, but we also have to double down in the next couple months here around our prevention measures, because we want to close out strong, as Dr. Williams has said to us before. And given that we got a big game coming up on Sunday, it's appropriate. We don't want to fumble the ball on the goal line. So there you have it. And with that, I'll turn things back to Miranda for questions. Thank you.
Thank you, Terry. We will now open it up for questions. So if any members of the media on the line have questions, please unmute yourself and go ahead with your question. Thank you.
Good afternoon. This is Courtney Estalti with Plain Dealer in Cleveland.com. I wanted to address something Commissioner Allen brought up. You had mentioned that it might be well into February before Cuyahoga County gets through the full 1A group. And I'm wondering, with Governor DeWine's target date of January 19th for 1B, how will that work? Will 1B have to wait in Cuyahoga County until you guys are all the way through the 1A group? Does it push that back so that 1B people, it's going to take longer for them to get it here?
Thank you for your question, Courtney. So what we're looking forward to, we know we have early next week a webinar set with other providers to strategize about just this question. So right now, the 1A group, if we look at those folks and who's taking care of them, we were glad to hear that home health will be getting vaccine, because home health was certainly part of that. So you've got residents that are certainly fragile that those folks take care of. They're 1A group members. And so if they're getting vaccine here in the near future, they can help out with that proportion of the work. We know that the pharmacies have been working through nursing homes and skilled nursing facilities, a range of long-term care sites, and hospitals have been vaccinating their staff. So we're hoping going forward, as we add hospitals that are participating with us going forward, pharmacies, federally qualified health centers, we have a webinar with these providers to talk about how we strategize this bridging of 1A to 1B. So in the urban counties, Cuyahoga, Hamilton, Franklin, Montgomery, for instance, this is a huge task, and with 100,000 doses being rolled out, as the governor described, across the state, we have to take into account that demand will clearly outstrip supply for quite some time. So prioritizing within those groups in 1A and even in 1B around, for instance, we think about those with chronic illnesses being particularly at risk among those 65 and older. And also even within the school systems, people who are older that have chronic illness could be prioritized because they're most at risk for complications and certainly for risk for fatality. So I would imagine those will be among the strategies that are going to be discussed next week as we decide how we will bridge 1A and 1B, particularly in urban counties. Some places downstate in rural areas, they may very well be able to move to 1B now because the populations are smaller, but certainly they're less vaccine available. So those are a few ideas that we expect to hear about next week to address some of the specifics of what you asked.
Thank you. And I guess I'm just wondering, you guys are working on bridging that gap and that strategy. Does the final say rest at the county level, or will the governor dictate to that to you folks?
Well, I would say, according to the governor, has given some latitude to work through those at the county level. We, as I mentioned, the Emergency Operations Center, and the governor spoke to this, in every county serves as a nexus point to bring us all together. We did it with H1N1. We used the Emergency Operations Center with Ebola for communication coordination. And the goal ultimately is that in the way that the state coronavirus website has a listing of all the testing locations for COVID on the site, and then you can then connect with them on the specifics of testing and appointments and the like, that we're going to be building basically a site at the state level that will be populated with places where people can get vaccinated. They may require appointments, certainly, and there may be specific age groups they're focusing on, but the Emergency Operations Center will be a place for all of us to come together in our community here in Cuyahoga to make sure that we are working hand in glove. And in every emergency I've been involved with for the last 30 years, all the partners come together to respond on behalf of the community in a way I think that is always very powerful and effective. And so I would anticipate that there to be some local latitude to make those decisions around how to best use the assets and capabilities of each one of those agencies to best serve our community and get as many shots in the arms as we can.
Okay, so the answer there would be you expect it to be a collaborative decision between locals and the state?
Yes, I think that definitely would be the case.
Thank you.
Sure.
Thank you. Are there any other questions?
This is Lisa Ryan from 90.3 WCPN Idea Stream, and I'm wondering if you have any data on the demographics of who's getting vaccinated in Cuyahoga County, and if it is like a disproportionate number of white people getting vaccinated, what are you doing to try to make it more equitable?
That's a very good question, Lisa. Off the top of my head, I'd have to go back and I don't know, but I think it's a very important question. So we'd like to follow up with you on that. I'm looking over at Kevin. We'll have to come back on that question and understand that. Certainly that is a very, very important question. And it helps us then to decide how we focus our work going forward to make sure that we close gaps to assure that we have equitable distribution. Our work that we've done with Metro Health around testing was designed to do just that, to bridge those gaps. Testing, working with the Greater Cleveland congregations and assuring that testing was widely available, particularly in communities of color. And so that is certainly our goal going forward, is to assure that those that want to be vaccinated can be vaccinated, and that everybody has an equal opportunity for COVID vaccination if they wish. So give us some time. We'll follow up with you on that.
All right, thank you. I look forward to hearing from you.
Any other questions?